I am Dr. Chandravathi, Senior Consultant Dermatologist at Care Hospital, Banjara Hills. Androgenetic alopecia in men is a very common thing nowadays we are seeing. Androgenetic alopecia means it is balding. In layman's terminology, it is called balding. Balding nowadays we are seeing even at the age of 20 years, even less than 20 years of age also, we are seeing balding. Why it is coming so early? Maybe because of the lifestyle changes, because of the stress the children are facing in the school, in the families, everywhere, competition, because of the stress and change of lifestyle modifications, lifestyle changes, eating habits, all these got changed. So that is why people are getting very early. These balding signs are coming very, very early. At the age of 20, 25 years of age itself, we are seeing lot of androgenic alopecia. The name itself indicate androgenetic alopecia. So there is a androgenetic hormone. Androgen is male hormones. There is increased male hormone influence on the hair follicles, on the hair. So sometimes maybe the hormone levels are normal, but the hair follicles are too sensitive to the normal existing hormones also. That way also this androgenic alopecia starts in the early age. If there is a genetic cause is there, that mother side or a father's side androgenic alopecia is there, the children are going to get it at an earlier age, that is 10 years early than their father got it. So important thing is, olden days, that is 20-30 years back, there were no treatments for this androgenic alopecia. So they used to think that there is no treatment, I have to go bald, so they just take it like that. Because of age, I am getting this baldness. But now it is not so. There are a lot of treatments have come for this balding of the head. Only thing is, you must come early. You must come early for the treatments. Nicely, you can, there are a lot of medical treatments are there to take care of your hair fall and to stop the balding. So it's better to come early than late. If you come late, what happens? We can get only a certain extent of hair back, not all the hair. Even with the treatments also, only 50% of hair will come back, not the whole 100% hair will not come back. So that's why you must come early to take care of this androgenic alopecia. So usually we control this hair fall by taking care of the hair follicle not getting influenced by the androgenic hormones. So we give oral treatments and topical treatments. And another important thing is, all of you think that one time, so if I take for 1 month or I take for 1 year, that will be enough for lifelong. No. The process of balding happens throughout your life. So throughout your life, once you start the medicines, you have to continue those medications. Even if you go for hair grafting, hair transplantation also, you have to use this medical treatment forever. Because even though they transplant or they graft the hair, the rest of the hair that is there on your head can go off because of the androgen influence. Remember this part of it. So the most important thing that you should learn is, medical treatment is the best treatment. Start early. Whatever the doctor prescribes you, start early. Definitely you can keep your hair on your head throughout your life.